Okay. Would say with what you just saw, it's not always entirely important to know exactly what's going on with the person to be able to provide assistance or to be able to get a hold of EMS. That's good information to know, good tests that you can perform like the face, arm, speech, and time, but you're not in it to diagnose so much as to just realize that there is a problem and get them to a hospital. The sooner you get them to the hospital, the sooner you get 911 there, the better off you are, especially with the stroke. A lot of times with stroke, they're able to get you to a hospital. If you get to a hospital inside of 4 hours, they can give you medications that'll break up the clot and you can get a lot of your function back. If you wait beyond 4 hours, the damage is usually done at that point, and the person who had the stroke may be debilitated for the rest of their life. So time is very important. One thing you're going to have with that is if somebody goes to bed with their partner, they wake up the next morning and they notice that their husband or wife's face is drooping and they can't move their arm. You went to bed 8 hours ago. They're not going to be able to get that medication because nobody's seen them alert or moving around for 8 hours. So time is very essential for that. There are some diseases that will mimic the stroke a little bit. So you need to have, the face drooping, the arm drifting on the same side as the droop. And if they stick their tongue out, their tongue is going to go to the direction of all of the drooping as well. So you kind of want to see a couple different things before you would know that it is in fact a stroke. And then loose lips sink ships. It's kind of difficult for anybody to say. If you say it to a stroke victim, they're not going to be able to get almost any of that out. And that's going to kind of help you understand that they are indeed having a stroke. Or they may get words or phrases confused depending on where the stroke is. So if you ask them, well, what day is it? And they say cheeseburger, you may start realizing that something is not entirely right. Seizures, they were showing as well. Anybody ever here to put peanut butter in a seizure victim's mouth? That used to be one that people would do. I think they're trying to protect the tongue, but what happens is then the person chokes on the peanut butter. Or people used to put sticks or tongue depressors in the mouth of somebody that is having a seizure. Again, to prevent them from biting their tongue off, but then they bite the stick off and they choke on the stick. You never want to stick anything in the mouth of somebody having a seizure. Tongues heal. If they bite their tongue, that tongue's going to heal a lot better than if they break all their teeth because they bit down on a stick. So keep everything out of their mouth. Let them flop around. Just protect their head. Don't hold them down as they're having those contractions. If you're holding down on their arm, they're using so much force that you might break their arm trying to keep them to the ground. So just protect their head. Most times, like the video said, they're going to come out of it. Most people know that they have a seizure disorder. If it's 3 minutes, about 3 to 5 minutes or less, and they come out of it, you don't need to call 911. They go to the ER. The doc isn't their neurologist. The doc isn't going to know what's going on with them. They're going to need to go to their neurologist to get their medication checked. So 3 to 5 minute seizure, wait it out, and then see what they want to do. They're going to come out of that seizure. They'll be a little bit groggy, a little bit sleepy, but 3 to 5 minutes later, they'll come out and be able to at least tell you what they want to happen. Now, again, as the video said, if it's the first time they've ever had a seizure, or if it's a long seizure, you're talking 5 to 6 minutes or longer, and that's going to seem like an eternity if you see somebody doing that for 5 minutes. If you see that, you need to call 911 because that's going to be a major seizure that needs to get to the hospital. But just a smaller one. I've got a friend, she has seizures all the time, and you just know if she seizes for about 3 minutes, everything's fine. If it gets beyond that, then we would get concerned. It may look a little funny seeing somebody have a seizure, but you just try not to laugh at them at the time. Like my friend, I wait till she comes out of the seizure and then we kind of chuckle about it, but at the time, just protect their head, let them bite their tongue if they need to, and you're good to go. The other illness that is going to be of importance that they didn't really talk about on the video is going to be an allergic reaction. Anybody seen the EpiPens before, used one of these? Do you use it? Or have you just
No,
seen
I've used them before on campers.
Okay.
Yeah.
So that's pretty intense when you have to do that, isn't it? They carry it with them for the most part. Most of the time, if somebody needs an EpiPen, they are going to carry it on their person. They don't have much time from the time they have the allergen enter their system to the time that their throat is going to close up and they're going to not be able to breathe anymore. Allergic reactions, the way that they work is nobody is allergic to a bee that has not been stung by a bee, for the most part. It requires getting the bee venom in you. Your body goes and attacks the venom. Next time you get stung, your body sees that and it overreacts. And each subsequent time that you get introduced to that bee venom, the reaction gets worse. Most people who have their initial bee sting reaction won't be carrying an EpiPen. It'd be a subsequent one, 2 or 3 bees later, where they wound up in the hospital. Then the hospital would prescribe one of these EpiPens. They're life-saving. If somebody has one of these, their allergies are very severe, and they could die if you don't get this to them very quickly. They don't last very long either. You've got about 5 to 10 minutes after giving that EpiPen before the effects start to wear off, and they may start having that allergic reaction again. You need to keep an eye on their airway, make sure that they're breathing. You need to get them to a hospital as quickly as you can. Again, they're going to carry those with them. You can't use somebody else's EpiPen. Like if you have an EpiPen and you're having an allergic reaction, you shouldn't use your EpiPen on you. It's the same with like an albuterol or an inhaler treatment. You shouldn't be switching those up. If somebody has asthma and somebody else has an asthma attack, those medications aren't usually interchangeable. With the EpiPen, what you're going to want to do is you're going to pop the top cap off of it, and you're going to want to jab it into the thigh of the person having the allergic reaction. You're going to get it into the meaty part of the thigh here, and then you're going to rub that area, trying to get that medication to get into the system a little bit faster.
Topical, it's not like because it says no needle. So it's
Well, that's no needle because it's a sample.
Oh.
Yep.
So there is no
Yeah.
needle.
So what you do, you would pop this off,
Yeah.
and then you jab it like that, and this needle is going to pop out probably about that long. They're nasty needles. You would not want to accidentally poke yourself with it.
Yeah, it shoots that pretty forcefully.
What it's trying to do, because you don't have to remove the clothing of the person. They could be wearing jeans. That thing's going to go through jeans. It's going through a muscle. It's a nasty needle. But I reach into my pocket. I've got a pen. I've got a cell phone. This pocket, I've got my keys. I take that thing and I jab it into my thigh. It's going to go into my cell phone or into my keys, and it may not go into my thigh. So you might want to empty out your person's pocket prior to giving that, just because we carry a lot of stuff in our pockets, and you wouldn't want to bend that needle and have the medication not go in.